Hi everyone, and welcome to our daily show, The Big Story, where we discuss the hottest topics of the day right here in the heart of the newsroom. My name is Alyssa Wu, and I'm coming to you live from the Straits Times. We are streaming live on Facebook and YouTube right now, and if you're watching us on YouTube, do subscribe and click that bell button to be notified whenever we go live. I'll be joined very shortly by my newsroom colleagues, where we'll discuss the topics that got you talking today. Now, in Singapore, 1 in 3 deaths is caused by heart disease or stroke, and the chances of more Singaporeans developing such diseases will increase as the population ages. Hence, the focus on preventive action rather than care. I have here with me ST Correspondent Joyce Teo to talk about this. Hi, Joyce.
Hi.
Right. So, what comes under preventive action?
So, preventive action, that's about people today, they are living longer. So, it's about getting people to adopt healthy habits so that they can remain healthy and independent for as long as possible. So that will it will help reduce the risk of cardiovascular disease, and if symptoms appear, it's about helping people to manage them before a major event happens.
So where is the future of healthcare then, if we are going to focus on preventive measures?
So the doctors are saying, like this Dr. Michael Lim, he's the medical director of Singapore Heart, Stroke and Cancer Centre. He sees a future where the focus is on helping people to prevent such diseases and on helping them to manage it rather than only treating them when they become very ill.
Yeah, I understand. So what is the success rate of preventing heart disease or stroke just by living a healthy lifestyle?
Most of it can be prevented. So that's what the doctors are saying. Actually, more than 90% can be prevented.
That's quite a lot. So,
Yeah.
But there are certain things that we can't change, right?
Yes.
For example, like our age and
Your
there's
gender
more.
and your race. Yeah, but there are a lot of factors that you can manage. So there are a few. Okay, so the main things would be healthy habits like smoking, eating healthily, exercise, maintaining your weight. Those will help you actually control your blood cholesterol levels, your blood pressure levels, and diabetes. Yeah, those are key risk factors for heart disease and stroke actually.
I understand. So prevention health is not a new concept, and we've had doctors advising patients and the general public to live healthier lifestyles for the longest time. But why have so few people adopted this?
I think healthy choices are hard to make, and sometimes not very obvious. And if you look at the key factors like smoking, right, it's addictive. And once you pick it up, it's really hard to quit. So I think in the first place, don't even pick it up. And then as Prof. Tan Hui Chim, right, he's the director of the National University Heart Centre of Singapore. So he was telling me that people don't realize that their condition is chronic. I mean, you tell them that, yes, but you give them preventive medication, and then once they realize that, say their blood pressure, the level is okay, they stop taking the medication. So there are some misconceptions there as well. And then some people think that if you take certain drugs over the long term, they will be sick from it, they will develop side effects. But Prof. Tan was saying that if you don't get the side effects at the acute stage, right, it's unlikely that you will get them later on.
So do you think doctors play an important part in getting their patients to understand how the disease will affect them?
Yes, you have to know how it works. And then the doctors are saying, so to know how it works, how it affects you, and they have to also empower the patients to do things by themselves. So for instance, Dr. Lim was telling me that when people have diabetes, right, it's easy to tell them, okay, don't eat this, don't eat that, and avoid doing this, right? I mean, in real life, it's really very hard. But if you can actually see the effect of certain foods on your body, you would actually make the effort to avoid them. So he's saying that if you have diabetes, you monitor it. So maybe take 2 months to create a food list, look at the things that you really like to eat, maybe go to the restaurant, try them out, and then monitor it and see how it affects your blood sugar levels. So if it really affects it a lot, then obviously you will know you shouldn't eat it too much. Yeah.
So earlier we just said that, to live a very general healthy lifestyle. Do you have any specific advice on what the individual can do to decrease their risk of heart disease or stroke?
The tips, okay, so I was saying earlier, smoking is a key risk factor. So it's really important, like the doctor said, to quit smoking. It just causes a lot of diseases.
And another one is we should get our cholesterol and diabetes levels sugar levels checked regularly, right?
Yes, because these are the three, you should manage your three health conditions. Those are treatable risk factors, right? You can manage them. That's diabetes, hypertension, and your cholesterol levels. And actually, by living a healthy lifestyle, right, you can prevent this. So the key thing would be, you know, it's back to the boring advice, but it works. Like quit smoking, eat healthily, exercise, maintain your weight, and you know, like eating healthily, we're talking about eating less saturated and trans fat, and then eating less processed meat, less red meat, less sugary foods and too salty foods, and then of course eat more vegetables and whole grains. You know.
Right. Well, thank you so much, Joyce, for coming on the show to tell us more about this.